The Senate Committee on Commerce, Labor, and Energy approved an amended version of SB 193 that would raise the minimum wage from $8.25 an hour to $9 for workers who don't receive employer-sponsored health insurance. The measure would also repeal a law requiring employers to pay overtime after 8 hours of work in a 24-hour period and would only require overtime once an employee works more than 40 hours in a week. In February, 13,226 initial claims for unemployment insurance were filed in Nevada, down 15.1% from last month as the seasonal layoff period comes to a close. However, initial claims are up 6.3% from February of last year when claims were 12,440. SB 372 was introduced last week. The bill calls on state officials to issue medical marijuana cards for animals if their owner is a Nevada resident and a veterinarian certifies the animal has an illness that might be alleviated by marijuana. A bipartisan group of Nevada senators is introducing a bill legalizing physician-assisted suicide. SB 336 was introduced in the Nevada Senate and would allow terminally ill patients to take medication, ending their lives. The measure would also allow doctors to prescribe a lethal drug to competent but terminally ill patients who then can self-administer the medication. Patients would need to request the procedure and could back out at any time. The bill allows health care facilities to opt out and prohibits life insurance companies from canceling a policy if a patient decides to end their life. A number of states have introduced similar legislation, but only Oregon, Washington, and Vermont allow the practice. Vineyards are allowed to grow statewide, but commercial wineries are restricted to rural counties such as Nye. Assembly Bill 4 would expand that to Clark and Washoe counties. As the bill stands now, wineries wouldn't be required to produce Nevada grapes. They can be imported from powerhouse neighbors. According to federal law, for wine to be called a product of Nevada, at least 75% of grapes must come from the state. A state senator hopes to change the Nevada Constitution to abolish the Silver State Health Insurance Exchange. SJR 14, which was introduced last week, the measure would prevent any Nevada agency or local government from creating or maintaining an exchange where people can buy health insurance. The resolution would need approval from 2 consecutive legislatures and voters before becoming part of the Constitution. A separate bill seeks to invalidate the exchange sooner. I'm Deanna O'Donnell. That's your news across Nevada.